Welcome to Cavernoma Alliance UK. The video you will see on this DVD is about symptomatic, incidental or people with genetics of Cavernoma. You will see on this DVD clinicians, Dr. Salman, clinical neurologist at the University of Edinburgh, Mr. Neil Kitchen, a consultant neurosurgeon at the National Hospital in Queen Square, London. You will have the opportunity also to go into the sections of this DVD that have testimonials from members who've had neurosurgery. I hope you find this DVD to be of information and use to you. Please become a member by clicking on www.cavernoma.org.uk. How to become a member. Fill out the sheet, it's all free, and come along to one of our events. And I, for one, look forward to seeing you.
A cavernoma is a small cluster of abnormal blood vessels which is found in the brain, spinal cord and rarely other parts of the body.
If you scan people using advanced imaging techniques like magnetic resonance imaging or MRI, you find that an awful lot of people are wandering around with abnormalities in the brain that they never even knew were there. In fact, if you take 37 people represented by this group of 37 brains here, and you scan them with brain MRI, even though these people have no neurological symptoms whatsoever, 1 in 37 of them may have an underlying abnormality that could one day cause a problem. And you see that illustrated by the one red brain amongst the 37.
Cavernomas occur in about 1 in 600 people in the UK, which is enough to fill Wembley Stadium.
What causes these cavernomas? Well, most of the time actually we don't know. When the ideal test to diagnose a cavernoma is used, and that's brain MRI, most people just have one cavernoma in the brain when scanned. But when there's more than one, that suggests an underlying cause.
There are 2 recognised causes of cavernomas. Firstly, previous radiation treatment to the brain.
When people have multiple cavernomas, this may have arisen as a result of their exposure to radiation for the treatment, for example, of a tumour in childhood.
And secondly, inherited genes.
The genetic changes that can lead to cavernomas arising can be inherited in families with a 50-50 chance of that abnormal gene being passed to the next generation.
The correct method of diagnosing a cavernoma is with an MRI scan.
In particular, the gradient echo sequence that is conducted as part of an MRI is very sensitive to blood products, which helps diagnose cavernomas.
CT scanning and angiography are too unreliable to be helpful. Many patients diagnosed with a brain cavernoma have no symptoms at all, or have symptoms totally unrelated to their cavernoma.
When cavernomas do cause symptoms, they may cause a stroke due to bleeding from the cavernoma, or they may cause an epileptic seizure. The type of symptoms people experience in either a stroke or an epileptic seizure depends on where the cavernoma is located. So, for example, if a cavernoma is located in the motor area of the brain, the result of a stroke there may be weakness down one side of the body. Equally, if somebody has a cavernoma in the brainstem at the junction between the brain and the spinal cord, there may be problems with eye movement or articulation of speech or coordination. Equally, if somebody has a cavernoma over the surface of the brain, that's where it may be most likely to cause epileptic seizures. and the type of epileptic seizure somebody experiences may further depend on where the cavernoma is in the brain.
Treatment is available to treat both seizures and other neurological symptoms.
So there are two different sorts of treatment that can be used for people with cavernomas: medical and surgical treatments. Medical treatments are pills, tablets that may treat your symptoms. So for example, somebody may experience epileptic seizures as a result of their cavernoma and may need anti-epileptic drugs to try and stop the seizures occurring. There are surgical treatments, and there are two different types.
Firstly, neurosurgery, and secondly, stereotactic radiotherapy.
So neurosurgical excision, or brain surgery to you and me, is the mainstay of treatment for cavernomas.
Neurosurgery involves an operation performed under general anaesthetic to remove the cavernoma.
This involves opening the skull and finding the cavernoma very carefully and removing the cavernoma and sometimes some of the blood-stained tissue around it.
The method employed and the risks involved depend on the location of the cavernoma in the brain.
Another form of surgical treatment is so-called radiosurgery or stereotactic radiosurgery.
Stereotactic radiotherapy involves targeting multiple accurate beams of radiation to the cavernoma and is usually employed where brain surgery would be too dangerous.
So the reason for performing treatment on cavernomas is to try and prevent them bleeding. The treatments themselves, of course, have significant risks.
And we need to weigh up the risks of leaving the cavernoma alone versus the risk of the treatment itself.
We also know that the risk of bleeding from cavernomas seems to get less as time goes by, creating a lot of dilemmas about the long-term balance between the risks and benefits of treatment.
My cavernoma is in my left occipital lobe, medial wall, left ventricle horn.
Right temporal lobe above, kind of said it's above my ear, in there somewhere.
In my brain stem.
In my thalamus.
Here, at the rear of the front left lobe. It's quite close to the temporal lobe and fairly close to Broca's area for speech, but luckily not affecting it, as you can tell.
Basically, I had a big seizure that happened in January of 2014, and they basically didn't stop for approximately 3 hours. It was stop, start, stop, start, and they couldn't get them under control. So that made it necessary for me to be incubated into a coma.
I'm not really sure, I wouldn't know. I haven't got a good memory in some respects, but at the same time, I have no idea.
It basically started to tingle all the way down the left. My left arm ached, I couldn't use my left hand, my left leg ached. When I basically the left side of the body just went into weird functioning mode. It didn't coordinate with the right. Yeah, speech, hearing, affects your hearing. I was deaf, I was shouting, I'm still deaf I think, and I still shout, symptomatically of that. But yeah, all of that does affect. And the numbness in your face around here. So they were stroke symptoms.
Basically, I just had all the symptoms of a stroke. So my face drooped on the left-hand side and the right-hand side, sorry. And I just got very unbalanced. My right-hand side wasn't really working very well, and then I had to just go into hospital.
I had pain in my back, and originally I'd had numbness in my feet, in one foot, and then it went to the other foot, and I began to think this is a little bit strange. I started tripping up and falling quite often.
The classic symptoms which I seem to demonstrate are inappropriate behaviour, disinhibition and risk-taking, which I quite enjoy anyhow. But for people who are around me, that can be a challenge. And then there's a slight problem. Every symptom that cavernoma sufferers claim they've got are always seen to be dismissed by neurologists and neurosurgeons. They always say, oh no, that's nothing to do with your cavernoma, whether it's migraines or whatever. The only one they'll admit to is epilepsy. And that is a problem. So quite often we're in the dark at identifying symptoms and behaviour.
I was really relieved that I could have the surgery, or that I knew it was quite a dangerous operation in that it could lead to paralysis itself, but I was just sure that it would get rid of the pain. And my main thoughts at that point were, I want the pain to go.
No, I haven't had surgery, no. I went and eventually saw a neurosurgeon at the Queen Elizabeth in Birmingham, Mr. Chelravaja, who's a lovely fellow, and he explained to me that the risks associated with the location to my site, because of the location of my cavernoma, it was best to take a wait and see approach.
No brain surgery, but I did have, I wrote it on there, an angiogram, so a brain camera.
When we are diagnosed with a cavernoma, how we react is a very personal way of reacting, and it reflects our existing personality. My personality, for example, has never considered, so far, medication or surgery. I don't want people messing around with an ice cream scoop in my brain. I've seen success stories. I've also seen the stories which weren't so successful, and I think if my quality of life is good enough, and it is as I perceive it, I don't want bits of brain taken out which might lead to worse side effects. And I'll never get back, I'm sure, to where I was before. You can't reverse what's happened.
I had gamma knife. It was the only thing that I could have at the time, because the neurosurgeon at Sheffield said if you have another bleed, it could kill you, and that frightened me.
One night I got a really awful headache, and it was probably the worst pain I've ever experienced.
Really?
And I went into hospital, and then I had to get an ambulance down from Norwich to London in the middle of the night. It was a bit scary, and it turned out I got hydrocephalus, which I don't know if you know what that is, but
it's fluid of some kind.
yeah, you have cerebrospinal fluid flowing around your brain, and I had to have a drain inserted for that, which was quite weird, but it made me feel so much better.
Yeah, it's helped me because it's deepened my understanding of how individual the experience of cavernoma is. You know, everybody's story is different. Everybody, you know, we're all unique, and it's true that as unique as we are as individuals, obviously our cavernomas are unique, and also is that sense of belonging. Yeah, it's a sense of belonging, and I understand that there's somebody out there that can appreciate where I've been and what's happened to me.
Feel kind of less alone. In a sense, I feel like the neurologist or whatever just tell you you've got one, and then you get kind of dumped.
With the cavernoma, when my family found Cavernoma as a website first, and then my husband drip fed bits of information to me via the website, and then I slowly became part of that. And then when the Facebook pages came up, I wanted to be part of that. I wanted to be able to spread the fact that there are, you know, ways of coping with things, positive things, you know, ways of getting through tough times, and it's always good to share.
Well, it's like a second family to me, because you being who you are, I know I can ring you at any time of day, and you're always there. And Ange. You're like a brother and a sister to us, and we're very grateful.
Cavernoma Alliance UK was different. It had particular knowledge, a high motivation. Neurologists, in my experience, seemed to be like mine was an expert in Parkinson's disease and things like that. So Cavernomas came pretty low down the pecking order of knowledge, interest and their personal motivation. So going to Cavernoma Alliance UK was suddenly different. This was people who really knew about the condition, what was available in the way, and were able to sort of give support and guidance.
Cavernoma Alliance UK was set up by a very determined group of people affected by cavernomas to recognise the need for information, support and greater awareness about cavernomas. The organisation exists to provide information for people affected by cavernomas, their family and their carers. Secondly, the organisation is there to provide support for people who are affected by cavernomas. And lastly, the organisation tirelessly campaigns to increase awareness about cavernomas and to improve the outcome for people with this common condition.
My cavernoma is in my left occipital lobe, medial wall, left ventricle horn, I believe, around about that area. So it's there. From what my neurologist told me, is there's a certain amount of interaction with the parietal lobe. When we were discussing why I was experiencing certain symptoms, it said, although it's occipitally lobe is where it is, because it's quite close to these other areas. That's why you can experience a range of symptoms. Well, the first instance of discovering that I had a symptomatic cavernoma was basically I had a big seizure that happened in January of 2014, and they basically didn't stop for approximately 3 hours. Stop, start, stop, start, and they couldn't get them under control. So that made it necessary for me to be incubated into a coma. So yeah, that was when it first presented as being cavernoma, but obviously most of that part of my journey, the last thing I remember was just having lots of flashing lights and barreling of vision, and then obviously it was my immediate family that had to have the scare of all these things because I was blissfully unaware. It was, looking back on it, at the time things seemed to be, everything was happening very quickly. So my emotional responses to everything, my understanding of what was happening, everything was very confused. It wasn't really helped because I was in a local hospital and everything was being faxed through to neurologists at the Birmingham hospital, Queen Elizabeth. So there was issues around in that. So, and also because when I was extubated from the coma, it took me a long time. I had to have a rehabilitation team because I couldn't remember very much. I mean, it took me 2 weeks alone just to realise where I was and that family members were having vigils and things. So it was a slow progress, but overall, it was the initial inertia of being in that state of coma to start getting the cognitive processes back going, and also the seizure activity, because it took a while I started off on a low dose of anti-seizure, and progressively that was high, it was incremented to a higher dosage, and then things started to slow down a little bit. But yeah, it was looking back on it now, it was a journey. Most of the anxiety of that journey was not having answers to questions and not being able to pose those questions, because at the time I was inhibited by still the symptoms of coming out of the coma and the seizures and all of the post-seizure symptoms that are. So it was very difficult to understand where I was and what was happening to me. No, I haven't had surgery, no. I went and eventually saw a neurosurgeon at the Queen Elizabeth in Birmingham, Mr. Chelravaja, who's a lovely fellow, and he explained to me that the risks associated with the location to my site, because of the location of my cavernoma, it was best to take a wait-and-see approach with regards. He confirmed to me that I'd had a hemorrhage, which was seems weird to say it now, was reassuring to me because it was contrary to the advice that I was getting from my other hospital. So, and that left me feeling confused. So I was although it does sound strange to hear, I was pleased to hear that it was what I thought it was and it gave reason for why I was feeling the way I was feeling. The uncertainty in itself can trigger a lot of anxiety, and that can create a lot of stress, and the feelings that you get or any sort of symptoms can sort of confuse the issue, because obviously you're unaware of what symptoms, if it's stress related or if it's related to the cavernoma. And quite often my experience is, if some of the doctors can say that aren't as experienced at dealing with cavernoma, can say that something stress related, it's far easier for them to come to that conclusion. Sometimes you feel, well, there's always that doubt, is this me or is this my cavernoma? But I think the one thing that I'm grateful for, and the one thing that my experience with cavernoma has taught me, is before my cavernoma, I was always the sort of person that was definite. I was in control of my destiny. I controlled what happened to me, and I was in charge of the ship. And now I'm a bit more pragmatic. I understand that there are things that absolutely I'm in control of and I can control, and there are things that are slightly outside of that I can have influence. But most importantly now, I know there are some things that I have little or no control over, and actually I'm fine about that. I have to say that being part of the Cavernoma Alliance, the support and the education was actually really vital and important to restoring that emotional equilibrium, because when you have this traumatic life event, it's very important that you get your balance back, and having something outside a neutral place so you can come and talk to people and make a relationship and get an understanding of what's happening and why it's happening. It's absolutely vital. Yeah, it's helped me because it's deepened my understanding of how individual the experience of cavernoma is. You know, everybody's story is different. Everybody, you know, we're all unique, and it's true that as unique as we are as individuals, obviously our cavernomas are unique to size, location, but they're all equally important. Everybody's experience is valid, you know, and we can all bring a degree of relativity. You know, what's helped me is to understand that what's happened to me is in context. I understand that compared to other people, I'm very lucky. I'm very lucky. So it helps me, and also is that sense of belonging. Yeah, it's a sense of belonging, and I understand that there's somebody out there that can appreciate where I've been and what's happened to me, and likewise, and we can offer support to each other. And I would definitely say it's a sort of an extension of a family.
Right temporal lobe above, kind of said it's above my ear, in there somewhere, apparently. Well, they told me I think it was about 2 years ago, I saw a neurosurgeon. I was originally diagnosed as a result of hearing. They were checking my ears. So I'd never bothered to have my ears checked in literally all my life. I'm literally 54 now. I must have been about 52 when I was actually checked out. And they said, oh, incidentally, we need to do some MRIs to check out why your ears, or my right ear, wasn't working properly. But they didn't find anything to do with the ear. It works okay. Well, except it doesn't. So they don't know any reason why it does. That's on the wrong side of the head, I think. I've also got some hearing loss in my left, but that's not as bad. So went in, so in the end they found the cavernoma incidentally. And basically I think it was two neurosurgeons checked it out and just said, you've got an incidental cavernoma. And there wasn't a lot that they said really, except they showed me the picture on the screen, pointed out where it was, said it's a small one, sort of 6 millimeters by 4 or something, and said, would you like to ask any questions? And I was a bit dumbfounded at the time, so I didn't. And that was about it. They didn't ask me any other questions. They didn't ask whether you had any kind of symptoms or there was none of that. It was just kind of very clinical, as far as I could tell. I wouldn't know if I suspect I wouldn't really know if I did, because no one told. I'm not really sure. I wouldn't know. I haven't got a good memory in some respects, but at the same time, I have no idea. Yeah, because it wasn't really, nothing was mentioned to me. Anything I have learned about is probably from this organisation. Yeah, because so many doctors I've spoken to don't even know what a cavernoma is. That's my experience. Some did. I did come across the odd one or something who did. Most didn't seem to be. Yeah, so it was a bit of a mystery to them. I suppose it does. There's always something in the back of the mind, in the sense you wonder whether the way I am now, in terms of personality or whatever, is in some way to do with the cavernoma, but I don't know though. I wouldn't know.
Do you find your personality changed ever since your diagnosis?
Probably, possibly, maybe a bit more kind of thinking back at things. You think, oh, does this cavernoma, has it had an effect? And there's a bit more of a tendency to question your own memory, whether it affects my memory or not. I'm not, but other than that, I'm just not quite sure. A lot of it's kind of like I just haven't got a clue. I don't know.
What do you find are the strengths?
Oh, it's nice to meet the people. I think I suspect I suffer a lot less than other people from the effects of cavernoma, if I suffer anything at all. But I think it's a really good organisation. You feel kind of less alone, in a sense. I feel like the neurologist or whatever just tell you you've got one, and then you get kind of dumped. And no one, and from then on, there's nothing else. And they just said to me, well, you've got an incidental one. It doesn't look like it's done anything any time recently for a long time. It may be something that's born with. congenital. And basically they said, you're discharged. No further checking up or anything. It just said, I think that one of the neurologists said, if you have a problem, you'll know about it. And that was about that was the end of it.
Well, I didn't know it was bleeding at the beginning. And when it started, I was a freelance horticulturalist. So I was gardening and my pruning hand just started to ache a little bit, give a little bit more sort of, not quite pruning. And I thought, I'd pulled a muscle in my fingers. So I didn't think anything of that. And then I carried on with working, because I also had another job at that time. And so when I carried on working and I was driving to another venue that I was working at, I started having double vision. And I thought, this is a bit strange. It's slight double vision and I have bad vision. So I thought it was connected with my eyes. So for me, I drove my daughter back from a concert that evening. I thought, that was just strange. Went to bed, didn't think anything of it, thought that would go by the morning. Next morning I woke up and I thought, this double vision is still here. So it wasn't that bad. It wasn't that bad then, and then that's when, this was in 2008. And then the double vision started getting worse and worse during the day. So I was advised to go to the GP or go to the opticians. So I booked an appointment for the GP the afternoon and rang the optician straight away. I went to the opticians, had an eye test. He's saying, can you look here? Can you look there? His face was a little bit strange looking and sort of said to me, I think you need to go to the doctors or find someone this evening to see. And I said, well, actually, I've got an appointment for the doctors. I couldn't drive here because the double vision's so bad. My husband is outside, so we've got an appointment about 4. He said, yes, go straight to the doctors. So the symptoms were very minor then for me. So I went straight to the doctors. We as a family are very lucky that we actually have private medical health care. And without that, I think I would have been a lot worse. So we were very fortunate because that evening in my village we can get a doctor's appointment on the same day, which is quite rare. So my GP looked at me and then said, okay, I think you need to see an eye specialist this evening, which is an absolute godsend. So off I went that evening to an eye specialist locally. He looked at me and said, I think you might have a squint. So I came out of the appointment thinking, I can't believe it. Got to 40 and now I've got a squint. I don't believe it. And I was feeling all okay, apart from my eyes were squinting and double vision. He said, I'd like you to see a neurologist. And I thought, being a bit over the top here, because it's private, being a bit over the top. Went to see the neurologist the next day. He sat me on the couch and my symptoms were still only double vision then, and a little bit of pain in my hand. When he put me on the couch, he did all the symptoms tests for stroke. Lifted my arms, asked me to squeeze things. I just looked at my husband, I thought, really over the top, really? And then he said, right, we're going to put you through for a CT scan and then an MRI scan. The CT scan first, isn't it? The little half moon one. So we went for that day or two later. Then, 2 days later, all symptoms kicked in. I had, the bleed was obviously, it was oozing slightly, but then it started kicking in because it's in the brainstem, affected all the left side, not my right side, my left side of my body. 2 or 3 days later, it basically started to tingle all the way down the left. My left arm ached, I couldn't use my left hand, my left leg ached. When I placed basically the left side of the body just went into weird functioning mode. It didn't coordinate with the right. Yeah, speech, hearing, affects your hearing. I was deaf, I was shouting. I'm still deaf, I think, and I still shout symptomatically of that. But yeah, all of that does affect. And the numbness in your face around here. So they were stroke symptoms. So then having that was quite scary, because I thought, well, actually, that's what they were looking for. I'm having a stroke. Went back 2 days, because it was private, which I am blessed, went straight back to the neurology, and they found something like a bleed in your brain. Didn't specify cavernoma, but possibly could be. He wanted to take the notes up here to the National Hospital and discuss them on Friday with the neurology team that was up here. So that's what he did. He brought the notes up, came back and said that's what it was. It's a cavernoma in the brainstem, and it's bleeding, and you really have to just sit and wait for symptoms and then treat symptoms. No brain surgery, but I wrote it on there, an angiogram, so a brain camera. Again, because I was a private patient, I had access to that facility. They asked me whether I would like to have an angiogram to confirm how many cavernomas, if at all there were any, in the rest of the brain. Very hesitant about that. Petrified about that. Went in to surgery for that, but it's not surgery really as such. It's just they go through your main blood artery in your leg, and then send a camera through while you're awake. And I had a bit of Barbra Streisand playing loudly. They asked me what kind of music I wanted, and I said a bit of Babs is good. And they talk to you because they don't want you to move your head. So I couldn't have something on that I was doing this with. So they said, so I thought I'd go for something still. And it came back fine. The angiogram was fine. But I mentioned today to some people I've met that I also have factor V Leiden blood disorder. So with the angiogram, you have to stay flat for 8 hours because of your main artery. Then the blood artery is cut, so you have to remain on the bed. And that's the factor V Leiden in my blood is a clotting agent. So I'm a contrary person, because the clotting agent, brain bleeds, so you're not meant to take any thinners or anything. I have to take thinners, meant to be, because of the clotting in the blood. No, not at all. No. I think the only time I think I would consider surgery in the brainstem, because it is a little tricky in there, it's a little tiny, little narrow place. I would say if it got to the point of quality of life had changed and it would make a difference. I feel that surgery, for me, at the moment, my quality of life is fantastic after it. I don't have any reason to risk surgery, weighing up surgery, and what the risks of coming out of surgery would have for me would change my life far more. So until I get to that stage, maybe in the future it may or may not happen, but if I got to the stage where quality of life wasn't good, then I would consider surgery. For me, I was an ostrich when this happened to me. I'm not a Google person, look up every detail. My family are, not me. Head in the sand, don't want to know what's happening to me. And so with the cavernoma, when my family found Cavernoma as a website first, and then my husband drip fed bits of information to me via the website, and then I slowly became part of that. And then when the Facebook pages came up, I wanted to be part of that. I wanted to be able to spread the fact that there are, ways of coping with things, positive things, ways of getting through tough times. And it's always good to share, another opinion, because second, third, fourth, fifth opinion, you always want more. Doesn't matter how many opinions you get, you always would value another one, just in case it's something you haven't, thought of. So the forum has been fantastic for that.
Well, I first got symptoms when I was 16 and they were very, very sudden. I basically just had all the symptoms of a stroke, so my face drooped on the left-hand side and the right-hand side, sorry. I just got very unbalanced. My right-hand side wasn't really working very well, and then I had to just go into hospital, and I was there for a few weeks, and I had a scan and it showed a quite substantial bleed in my thalamus. No, I didn't find them scary, but I can imagine how other people might do, because it is quite a sort of alien environment, and yeah, it must be quite a daunting process, especially because having an MRI scan in itself is scary, but also having one of your brain is even scarier, because you have to go all the way into this sort of tunnel of darkness, and then yeah, it's not very nice. So then I went home. I was 16 at the time, so I was just about to do my GCSEs. Luckily I didn't have to do them, and I just got marked on my mocks, which is great. I stayed off school for the rest of that year, and then I went back into sixth form. I think they found it a bit weird and a bit sort of strange that I'd had what was essentially a stroke, and that they didn't really know how to respond at all. And you know, that was fine. I probably wouldn't have known how to respond if someone I knew had a stroke when I was 16. So the teachers were a lot more sort of receptive to my needs. It just felt a bit awkward because I suddenly came back after months off school, and everyone just treated me as normal, and so I just found it a bit hard to kind of emotionally process it, I guess. It was only when I had got my results and I knew I was going to go and do medicine at Leeds Uni that I started to get symptoms again. I'd done a year, half a year pretty much, and it was after Christmas I started getting symptoms. It felt like everything anyone was saying just went completely over my head, and I wasn't really listening, even though I completely was, and I was trying really hard. Also, my right hand, it got to the point where I could barely move it, and I had to use my left hand for eating and everything. My handwriting was absolutely appalling at that time. I started to get headaches as well, and one night my headaches were so bad that I actually fainted in my hall's kitchen, and my friend took me to A&E, who I was living with, and there they gave me a CT scan. They said, oh, it's actually growing quite a lot, and we need to operate on it. And this is despite them saying when I was 16 and I had the scan, I had the bleed and everything, they said, we're definitely not operating on this, it's too dangerous, and then they said that they had to operate on it. Yeah, it was the Cavernoma Alliance, so a few years previous to that, me and my mum had gone down to London to see a day that they put on, and we met him there. So he said that he'd send me a date, like probably in the next 2 weeks or something. However, unfortunately, one night I got a really, really really, really awful headache, and it was probably the worst pain I've ever experienced.
Really?
And I went into hospital, and then I had to get an ambulance down from Norwich to London in the middle of the night. It was a bit scary. And it turned out I got hydrocephalus, which I don't know if you know what that is, but
It's fluid of some kind.
yeah, you have cerebrospinal fluid flowing around your brain, and it's when the path of that fluid is blocked off by a tumour or something of the sort. So yeah, I had to have a drain inserted for that, which was quite weird, but it made me feel so much better. Then about a week after that, I had the operation, and yeah, I had it in the morning, and I wasn't allowed food since like 12 o'clock at night or something, so I was quite hungry. And I went down, and then I had the operation then. Well, I can't actually remember when I first came out, but my mum was telling me that I was very, very upset because basically, in order to get to the thalamus, you have to cut down the corpus callosum, which is the split between your right and your left hemispheres. And when you do that, you basically stop one side of the body moving. And for me, it was my right-hand side. So when I woke up from surgery, I couldn't move my right-hand side. So it was obviously, I think it was quite an emotional moment for me. Yeah. To be honest, it's been quite a sort of varied process. I'd say, I mean, to get basic movement back, it probably took about 3 weeks. And then to get kind of intricate, detailed movement back, a lot longer. I didn't really have a choice, to be honest. So I think, I don't know, I think that's quite a difficult question to answer.
I discovered my cavernoma was located here at the rear of the front left lobe. It's quite close to the temporal lobe and fairly close to Broca's area for speech, but luckily not affecting it, as you can tell. Originally, I tend to think, I saw only a neurologist at first, and there was a lot of confusion, there were a lot of delays. Initially, I didn't get a diagnosis for several months. I was kept in hospital for a week waiting for an MRI scan, but there was never a bed or a slot available. So I was sent home, and a few months later, they did do some scans. They said, yes, I'd had a bleed and stuff, but nothing. And it was diagnosed as an arterial venous malformation at first, and eventually they had to reconsider, said, no, it's a cavernoma. And of course, this is where things, I'd already joined an association for AVMs. At this point, I discovered it was a cavernoma, so I went on the internet within minutes of getting home from the hospital and started making contacts with Cavernoma Alliance UK. See, it depends who you ask. If that's my wife, she would say I'm the same as I always was, but with the brakes off. And this is where cavernomas are so individual. The brain is a highly complex organism. Mine happens to be here at the rear of the front left lobe. And the front left lobe, you know, it's associated with certain kinds of behaviour and control. So, for example, the classic symptoms, which I seem to demonstrate, are inappropriate behaviour, disinhibition and risk-taking, which I quite enjoy anyhow. But for people who are around me, that can be a challenge. And then there's a slight problem. Every symptom that cavernoma sufferers claim they've got are always seen to be dismissed by neurologists and neurosurgeons. They always say, oh no, that's nothing to do with your cavernoma, whether it's migraines or whatever. The only one they'll admit to is epilepsy. And that is a problem. So quite often we're in the dark at identifying symptoms and behaviour. I remember about 6 months after my diagnosis, I asked my staff in my office, I said, look, you know me, could you in confidence let me know what you've noticed as different about me since my first major seizure? And it was interesting, they came back to me and said, actually, you're slightly less empathetic, slightly more impatient of people than you used to be. You know, I tend to say, well, I've got a certain urgency now. When you come round in hospital after losing consciousness, wondering where on earth you are, it does affect you. And the changes in my behaviour, my neurologist has always said, oh, well, you know, belated male menopause or something like that, you know, just, but it's hard. There have been changes, and I've noticed, obviously, having the seizures is a big change in my behaviour, which does affect my life and my perceptions of life. At the moment, I'm caring for my baby granddaughter, and I sort of do a risk assessment before I walk downstairs, say, is it safe to carry? Because I had a seizure, a small focal seizure about a month ago, when I suddenly lost the use of my right side for a few seconds, which could be disastrous when carrying a baby. Now, this is interesting. Again, I've learned a lot as part of being involved with Cavernoma Alliance UK. And it's my wife again who once said, on a parallel thing, when you get older, you're like you always were, but your little foibles get exaggerated. And I've noticed with cavernomas, when we are diagnosed with a cavernoma, how we react is a very personal way of reacting, and it reflects our existing personality. My personality, for example, has never considered so far medication or surgery. I don't want people messing around with an ice cream scoop in my brain. I've seen success stories. I've also seen the stories which weren't so successful. And I think if my quality of life is good enough, and it is as I perceive it, I don't want bits of brain taken out which might lead to worse side effects. And I'll never get back, I'm sure, to where I was before. You can't reverse what's happened. So in the same way so far, even though I'm pressed every year to take sodium valproate or other carbamazepine and all sorts of other epilepsy controls, when my consultant said to me last January, really you should be on medication because you could die in your sleep, and my reaction was, what's wrong with that? I'd be delighted to die in my sleep and not know about it, even at my age. So that's where my personality, though, affects my reaction. So every year the consultant writes to me and says, you've been offered, but you've refused for your reasons. It covers him. But that's where I am. I'm very happy. I'm a very lucky person. My particular cavernoma causes symptoms, but I don't have stroke-like symptoms. I have seizures about every 18 months to 2 years, perhaps a little more often, of varying intensity. And that for me is fine. So I'm lucky. And that's why I've been able to be involved and give some support as a way of a thank you to Cavernoma Alliance UK, whilst recognising that every single member has a very individual story and an experience. It was the first bit of clear information and a breath of fresh air. You know, the consultants didn't know. My consultant, lovely man, I do see him every year still, because he likes meeting up anyhow. They didn't know about cavernomas. They weren't able to identify them, hence the several months delay in the diagnosis. So Cavernoma Alliance UK was different. It had particular knowledge, a high motivation. Neurologists, in my experience, seems to be, like mine was an expert in Parkinson's disease and things like that. So cavernomas came pretty low down the pecking order of knowledge, interest and their personal motivation. So going to Cavernoma Alliance UK was suddenly different. This was people who really knew about the condition, what was available in the way, and were able to sort of give support and guidance.
When I had my first bleed in 1986, I was actually pregnant with my oldest daughter, and I went to the GP who sent me to an orthopaedic surgeon because I had pain in my back. And in those days they just x-rayed you and there was nothing obvious on the x-ray, and he just said physio. I did have physio, and they decided in the end that I'd had a burst thoracic disc to have the sort of pain that I was under, and that I just kept going with the physio. I then had 2 more children, and looking back I probably had bleeds around that time, but I couldn't pin it down. And I just felt that that I had this long-term disc problem, and that I just had to try and keep healthy and, do exercise and everything and just get through it. And maybe after I'd had children and stopped picking them up and all that sort of thing, it might all settle down. It never settled down. And originally I'd had numbness in my feet, in one foot, and then it went to the other foot. And I began to think, this is a little bit strange. I started tripping up and falling quite often. And I kept going back to see rheumatologists because people assumed the pain was rheumatic based. So the first MRI scan I had was of my lumbar spine, and it became historic because they just thought, oh, it was a lumbar disc, and the pain in my leg was sciatica. And although I kept saying, no, I think it's higher up than that, it became historic. So each time I saw a doctor, they travelled down the same path. I began to think I was a complete hypochondriac. And it wasn't until 2011 when I was in horrendous pain at that point, and I finally saw a rheumatologist who did all the tests and came back. They were all negative, and I burst into tears because by then I just wanted to know what was wrong. And she said, no, it's neurological. I think it's neurological. She did a really simple test. Babies have a startle reflex. If you touch their feet, their toes go like that. Adults ball their feet like that. And she just ran her finger underneath my foot and my toes went out. So she said, it's definitely neurological. So that was the first time in all those years that I saw a neurologist. He took an MRI scan again and then carried on testing me, because originally he thought it must be a cancerous tumour. I thought it wasn't because I'd had it too long. And then he decided it had to be MS. So I assumed he hadn't seen anything, and so I had a year of tests for MS. And he got very confused because nothing seemed to come back positive. So he then re-scanned me, and I went to see him, and he said, oh, I do apologise. I realised, I know what it is. He said, and it's been there all along. But it was remarked on by the radiologist, but I hadn't realised its significance. And this was a neurologist, so that's a bit worrying. And even then he didn't think it was anything that I should worry about. But thankfully, he spoke to a surgeon about it, who rang me up and said, you need this out. I was really relieved that I could have the surgery, or that I knew it was quite a dangerous operation in that it could lead to paralysis itself, but I was just sure that it would get rid of the pain. And my main thoughts at that point were, I want the pain to go. And my surgeon said to me, I can't guarantee the pain will go, because it could just be a lot of damaged pain nerves, but I felt it would go. People who have spinal cavernomas tend to have the genetic form of the disease and have other cavernomas in their brains. I was very concerned about that, and I asked them if they would scan my brain as well. And I had the scans done again by the National Neurological people who were looking specifically for cavernoma in the brain, and they looked and looked and looked, and there weren't any there. I thought I might have them because I used to have headache. Every day of my life I had really bad headaches. But I realised after the surgery because the headaches went. But I realised after the surgery that the cavernoma was putting such a lot of stress on the whole system and such a lot of pressure within my spinal cord. It was sort of causing these headaches. But I know now that if you have a suspected bleed, that they give you, because it's basically you're injuring your spinal cord. And so there are ways that they deal with spinal cord injury. So if you have a bleed which compromises your spinal cord, they give you steroids, which lessens the damage. So I don't think people will get as bad as me. Hopefully.
I was diagnosed with ME for a number of years and fibromyalgia. And then the tremor in my right hand got pretty bad and a bit of head tremor. And I went to see my GP and he said, I think it's essential tremor, Glenn. So I said, well, I would like to see a neurologist. So anyway, I joined the Tremor Foundation. And then when I saw the neurologist, he said, he examined me, made me write down and walk around. He said, I don't think you've got Parkinson's. I said, I don't really want Parkinson's. And then he said, I think you've got dystonia. But he said, I could be wrong. I have been known to be wrong. And he said, I'll give you this medication, but I won't berate you if you can't take it because it's pretty strong. And then I'll review again in 3 months. So I went home and I always thought that dystonia was a country in Europe because I'd never heard of it. So anyway, as it happened, there was a dystonia meeting in Liverpool and we went along and we saw these poor people. They just couldn't control their spasms and it really upset us, and both of us went home and cried. And I said, I don't want to end up like that. No disrespect to dystonia. And anyway, I had an MRI scan, and within a week of having had the scan, the neurologist sent me a letter and asked me to come to see him. And he said, you're the star of Walton. He said, we found a cavernoma in your brainstem. And I was gobsmacked because I didn't know anything about it. So he said, I'll refer you to a neurosurgeon. So I went home, Googled it, and I think it was dear Ian's name that came up first. And then we came to the forum and fell in love with you, both of us. And that's where we learnt the most and we felt most at home. I had gamma knife.
How do you feel about gamma?
Well, it was the only thing that I could have at the time, because the neurosurgeon at Sheffield said if you have another bleed, it could kill you, and that frightened me. So it was my only option. Yes. Yes, because it gave me more confidence in that probably I wouldn't have another bleed. But I have had another bleed, but that's life. My right hand was pretty bad. I couldn't write, I couldn't do the normal things. But when I had the deep brain stimulation, it gave me my life back. And I had that done in 2008. And now that the battery is running out, I need another deep brain stimulation, but not in the same place in the brain. He's going to situate the bilateral stimulators in different areas this time.
I find it's hard work to start with, and then you realise you recognise symptoms. I look in her eyes and I can tell the way she moves or even the way she answers me, and I know when she's not well. But it's difficult to talk. I can't talk to Glenn when she's like that. I love her, but you know, I just can't, and you accept it. And you look forward to the good days. Of which
Well, it's like a second family to me, because you being who you are, I know I can ring you at any time of day and you're always there. And Ange, you're like a brother and a sister to us, and we're very grateful.
superb. Superb. It's like you go on the computer and there's a help button you can press, and that's what Cavernoma is. It's like a help button on the computer. You know, you can ask questions and you get answers.